there's a sin that us nonprofit people in the behavioral health field commit, and that is on a regular basis, we can easily assume that we're the only ones that really get it. And that, yeah, there might be other people or other organizations, but they really don't really understand the way we do. And so you can get really myopic and forget that, wow, there are really other organizations rowing in the same boat, and usually rowing in the same direction. And so it's quite amazing when you come across an organization that you swear was separated at birth from you because of how much our missions really parallel. The Co-Occurring Collaborative Serving Maine has been serving Maine since 1992, and has changed its name a bunch of times. Bob, our Director of Correction Services, he's got a plaque on his walls. I think it was the Co-Occurring Collaborative Dual, something or other. Totally different name, but continuing to evolve. And what we've seen over 20 years is an organization that has really embraced the charge to be the leader, to move us forward in the essential elements of what it means to be behavioral health providers in this state. They, as their name speaks to, have been really leaders in the area of working with people who have both mental health as well as substance abuse conditions that have seriously affected their lives. But that's not all that they've been doing. They have provided leadership in criminal justice, in integrated health. They had, I believe, one of the first ACT teams in the state of Maine. They have really provided initiative and leadership in making sure that we're using best practice standards in treating these conditions that are affecting people's lives. That's where my experience with CCSME came into first contact some years ago with Ken Minkoff and a bunch of other people who came through. And Kate was a part of a spirited initiative that basically said, we are going to change the way in which we do treatment in the state of Maine to break down the barriers between substance abuse treatment and mental health. So that basically there is no wrong door. Now I can tell you, this lady can be like a dog with a bone, because she was dogged in her pursuit of moving that initiative forward. David, I think you'd agree with me that Kate can really say, no, that's the way it's going to be. Because many people were saying, why do we have to do that now? Why can't we just kind of gradually move ahead? And as many times have been said in our history, Kate was one of those people who said, why not now? And moving ahead, the idea that we had to think differently, and we had to move ahead in making sure that we had the skills, and that we had the concept, we had the policies, we had the initiative, we had everything to continue to make a sustained effort in changing the way we think and act. And that is still what that organization is doing in all the other areas that I mentioned. Peer initiative, health homes, suicide prevention. So you can see why maybe we look like we were separated at birth. Because, again, our missions are very similar. The mission, as a matter of fact, for CSME reads, the Co-Occurring Collaborative Serving Maine advocates for best practices, encourages professional development, maximizes collaboration, and facilitates integrated health and behavioral health services. I can, for one, say that they truly do follow that mission. And they have followed that doggedly and making sure that we also pay attention. And so please join me in celebrating that this year we are acknowledging CCMSE as the Agency of the Year and celebrating their efforts over the last 20